Hello, Miss Smith. How are you doing today?
Doing good.
My name is Jenny, and I'm going to be one of the nurses doing your assessment this morning. Just get my hands washed off here. Let's see. It looks like you were in the hospital about a week ago for your heart failure, and this is your follow-up appointment with us. Did they offer you a flu shot this morning when they took your vital signs?
They did.
Okay, great.
They already gave it to me.
It looks like today, let's see, your blood pressure was 134/74. Your respiratory rate was 20. Your oxygen saturation was 98% on room air. That's very good. We've got you as being 5 feet 8 inches tall. Your weight today was 190 pounds, and that's putting you with a body mass index of 29.8, which is a little bit higher than we like to see it with our heart failure patients. We like to get that down a little bit, so we'll work on that with you here shortly. I understand you were in the hospital about a week ago. What happened?
I went to a family reunion and I ate things that I shouldn't have, and I didn't take my Lasix like I was supposed to because of traveling.
Okay, so let me guess. You had a little shortness of breath. Maybe it got a little bit worse, and then you went to the hospital. Okay.
Some edema to go with it.
Okay, and what did they do for you when you were in the hospital?
Lasix.
Gave you some extra doses of Lasix. Okay, it says here you were in the hospital for 2 nights. You were under observation. They did, in fact, give you some Lasix. It looks like they did not change any of your regular medications at the time that you were in the hospital. It looks like you met with a pharmacist there, and you had the opportunity to ask questions about your medications and all that kind of stuff. And it looks like they wanted you to meet with a dietitian. Were you able to do that while you were in the hospital?
No, because it was on the weekend.
Oh, you were discharged over the weekend. Okay. We have the ability here to set you up with the outpatient dietitian, and we'll make sure we do that before you leave. A couple things we're going to do today. I'm just going to do a real good physical assessment on you, kind of see how your lungs are sounding, see how you're eating. We'll look for any edema, things like that. And then when we're done, we'll talk a little bit about your heart failure and some things that we can do to help you manage it a little bit better. A lot of our heart failure patients, we find the more that they participate in the care, the better off they do. So we're just going to talk about some things like diet, medication compliance, exercise, and things like that when we get done. How does that sound? Okay. First thing I'm going to do is I'm just going to take a quick look at you overall just to kind of see how your appearance is, how you're feeling. I'll be touching you on your face, your hands, your feet. I'll be looking for some skin turgor to make sure you're hydrated well enough. I'll feel your temperature to make sure you're doing okay. The nurse said your temperature was 98.9, so you don't have a temperature or anything, but just kind of a general survey type of thing. So I'm just going to feel your hands. They're nice and warm. Just going to pinch you up a little bit here. Looks like you have some good skin turgor. Nice and warm there. I'm going to look to see if you have any jugular vein distension, which you don't. Let me check your feet down here if you can uncross your legs. What I'm looking for down here is to make sure you don't have any pedal edema. As you know, because you remembered it last time you were in the hospital, you had a little bit of trouble with that. That looks really good today. That does not look.
I do get it sometimes, normally. So.
You do sometimes normally get it? Okay, are you able to adjust your Lasix when that happens occasionally? Okay, super. What we're going to do now are some neurological tests just to make sure all that looks good for you. Can you go ahead and smile real big for me? Can you stick your tongue out? Good. Let me look at your hands real quick. Can you squeeze my hands? Hard as you can? Great. Super. Can you take your finger and touch your nose? Do it twice with that hand. Okay, and then twice with the other one. Okay, now can you take your finger and touch my finger? And then touch your nose. Super.
Come off the wrong direction.
Great. I'm going to ask you to go ahead and try to push up against my hands as hard as you can. Okay, and now push down as hard as you can. Super. I'm going to go ahead and do that with your feet as well. I want you to go ahead and push all the way up and then push against my hands. Super. I'm going to take a peek inside your mouth and just make sure you don't have anything in there. Nope, that looks really good. The next thing I'm going to do is just let you relax. I'm going to listen to some of your heart sounds. This is going to take a few minutes. I've warmed this up for you, so it shouldn't be too cold. That's very good. I'm not hearing any clicks or any murmurs or anything like that. Can I get you to sit up, and I'm going to listen to your lungs now. Want to make sure your lungs are nice and clear. We're not hearing any crackles at the basis or anything like that. Want to make sure you're not building any fluid up. Can you take some slow, deep breaths for me? Okay, one more. Okay, you can lean on back. I'm just going to listen to your lungs down here on this side. And over here. Great, that sounds wonderful. I'm not hearing any kind of crackles, any kind of fluid in there, or anything like that. So you must be doing a really good job with your medicine. How about eating? Are you having any trouble eating, any constipation, any nausea, anything like that?
Yeah.
How are you with following your diet, your low salt, low fat diet, for the most part?
I try to pay attention to it, but
Not so much. You've been eating out a lot? Okay. I think we are going to set you up for that appointment with that dietitian just to make sure we're giving you all the tools we can to let you manage things at home. Let me go ahead and listen to your bowel sounds real quick. All right, those sound good as well. How about using the bathroom? Are you having any trouble with constipation, having any trouble with burning when you urinate, anything like that? So all that's going good. Okay. It looks to me like you're doing very well managing your heart failure. I think you're definitely realizing what brought you in the hospital, what you need to do to stay out of the hospital. So for this visit, the things that I'm very comfortable with, it sounds like you're taking your medicine like you should. It sounds like your vital signs are all within normal limits where they need to be. Are you having any trouble with shortness of breath at all? Can you sleep okay at night?
Yes.
No problems there. I'm not going to adjust any of your medications. It sounds like you're on a good routine for you for what's going on right now. I do think we'll have to be a little more alert next time when you travel. And let's try to avoid getting you back in the hospital again. I noticed this was on your first visit to the hospital for an admission since the 5 years you've been diagnosed. So you're doing a wonderful job at home keeping up with things.
I try.
Good. We would like to see you exercise a little bit more. Is there any opportunities in your day to get some exercise maybe?
I'm sure there's plenty of opportunity. We discuss it every time I come.
Okay, so we're going to work on that maybe. How about if we start small? Maybe between now and the time I see you next week, you can do a little extra walking every day. How about that?
I will say yes.
You will say yes. You will try. It says here that you live about a mile from where you work at the elementary school. Maybe you can find some opportunities there. Maybe you can, on a nice day, walk to work one day, or you can walk around the track with a friend at school. Sometimes if we can buddy up with people, it really does help make it a little bit easier to exercise to where it gets to be a habit we don't even know we're doing it. So we can do that. Before you leave, I'll have the nurse come in and we'll make you an appointment with our dietitian so you can meet with her before next week and we can get some tips on how to incorporate a low sodium, low fat diet for you. And she can give you some great recipes that you can try at home. Do you have any questions about any of your medications or anything while you're here?
No, I don't know if I need to keep taking the extra dose of Lasix that they put me on when I was in the hospital.
When you were in the hospital?
I normally took 20 milligrams a day and they upped it to 40 when I was discharged.
Okay. It sounds like you're doing really good. We'll take that dose back down to 20, get you back on your normal routine. Be very alert for the signs, though, that you're having a little bit of trouble with worsening heart failure. You'll have some shortness of breath maybe shortness of breath when you're exerting yourself, taking a walk, walking to the mailbox, going upstairs, things like that. I also want you to be weighing yourself daily. If your weight goes up more than 1 to 2 pounds, you need to call and let us know, and we'll work with adjusting your medications. Are you using the same pharmacy all the time as well?
Yes.
Okay, it's very important with heart failure patients to use the same pharmacy. Over time, there's going to be a lot of adjustments up and down with your medicine like we just talked about with your Lasix, and it's important if you can go to the same pharmacist. They're going to be aware of that, and they can help you notice when you have imbalances and stuff and kind of keeping an extra eye on things for your medications, which is good. Are there any further questions that I can answer for you?
Should I continue taking the potassium supplements? Because they told me to take extra potassium last week when they increased my Lasix.
We'll go ahead and draw some more lab work on you on the way out, and we'll call and let you know. I would imagine you can start tapering that off now that we don't have you on those higher doses of Lasix. And we can also look with the dietitian about ways to keep that balanced in your diet, okay? Any other questions I can help you with?
Not what I can think of.
Okay, so your plan is going to be When I leave, the nurse will come in. She'll make you an appointment with the dietitian, and then we'll see you back in about a week. In the meantime, you're going to get a little bit more exercise. You're going to work with the dietitian about following your diet a little bit more closely, and you're going to get a little bit more exercise. How does that sound?
I don't have to come but one time next week?
Yep, you're going to come one time next week, and then we can start tapering after that. As long as you're doing your daily weights and keeping up with your medicine, we should do fine. Great. Thank you, Miss Smith. You have a great afternoon.
Good to meet you.